Thank you all for attending our Workplace Violence Task Force Committee meeting. I want to thank our hospital leadership, our CEO, our CNO, and our COO. Hospital leadership is vital to this program, it being successful. Your commitment not only to our staff, but our patients and our guests, the commitment of safety and a safe environment. I want to thank our Director of IT and our Director of Security, case management, nursing groups, physician groups, regulatory, housekeeping, dietary, and legal. All of us will play a vital role, and your commitment to this committee also will be a commitment to our staff and patients for a safe workplace and a safe hospital environment. Workplace violence is a significant worldwide occupational health problem. The potential for violence negatively affects not only our nurses and our physicians, but our case management, our dietary, our EVS workers, our housekeepers, anybody that provides patient care. It affects their performance and their job satisfaction. We're seeing more and more violent outbursts from patient families and the patients themselves because of changes in healthcare, changes in healthcare insurance coverage, changes in the way we provide care in our ED and pain management as it relates to medications and pain medications. Joint Commission, CDC, and OSHA define workplace violence as any physical, verbal, threatening, or verbal abuse occurring in a healthcare setting. And that setting could be a temporary setting where our staff are, or their permanent one, or even in our off-site clinics. Recently, Joint Commission provided data on an assessment that they did from 2013 to 2015. They analyzed all the incident reports that came in during those times. 33 homicides that occurred in a hospital. 38 assaults that occurred in a hospital. And 74 rapes against healthcare providers occurred in a hospital during those times. They looked at some possible root cause analysis that maybe not necessarily contributed, but maybe prevented help or prevented the situation from happening. What they found was lack of communication. These hospitals did not notify their employees that an incident has occurred and what to do. They also had adequate patient observation, meaning the patient-nurse ratio was too high. There weren't enough nurses to cover all the patients because employees had called out or quit because of workplace violence. They also found lack of or non-compliance of policies dealing with safety and workplace violence. They also found, lastly, they found the lack of adequate behavioral health assessments to identify aggressive patients. Meaning when patients were brought in by our law enforcement under a Baker Act, or if they were already admitted and they were making statements, they didn't have processes and policies in place to identify those patients and take care of their mental health needs. That's a lot that happened from 2013 to 2015. But we do have some solutions. And I've met with you each individually to come up with task actions that we could start providing for our healthcare staff and our community partners that come to the hospital. OSHA and Joint Commission have developed guidelines to help provide hospitals the knowledge and guidance under the OSHA Act to provide a safe environment, not only for staff, but patients. We're also going to identify and assess risk factors for workplace violence within our hospital, meaning we're going to look at access points, controlling those entrance and exit doors. We're going to look at lighting inside the hospital and outside the hospital. We're going to look at the number of panic buttons that we have on each unit, and do we need to put more? We're going to look at the number of security officers that we have and how many we need. We're also looking at education and training and hospital drills for all staff, not just our staff in our emergency department, but for all staff. And then we're also looking at a solution that we've already started today, a commitment from hospital leadership and staff from our hospital. Some of the assessments that we're going to be looking at that deal with inside patient departments or units is we're going to look at their own departmental unit safety plan. Have they exercised it? Do they have one? And do they understand what they're training? We're going to do regular walk-through environmental assessments. Once a week, we're already in the units conducting an environmental care assessment, and now we're going to add safety and security issues to that assessment. We're going to look at past instances. We're going to look at the after-action reports that we wrote on that and look at opportunities to enhance those plans. But how are we going to do this? Well, I've met with our nurse educators here at the hospital, and we have developed a computer-based or online interactive training that nurses, physicians, housekeeping, dietary, anybody within our hospital can do. This will be a mandatory online or computer interactive program coupled with departmental staff meetings, pass down information from unit to unit, from department to department. We're also going to look at tabletops, discussion drills, and actual hands-on drills dealing with workplace violence. We're going to be utilizing our community partners with law enforcement and fire rescue. We're also going to utilize our law enforcement partner to help conduct a critical infrastructure protection assessment. Again, looking at vulnerable areas and what we can do to provide a safer, more secured hospital. This is just the beginning. We'll be meeting once a month. We'll be meeting with subgroups, probably once a week with individual subgroups, creating task lists and creating action lists to have a successful workplace violence committee. I appreciate all of you being here today and your commitment to our staff, our patients, each other, and our community. And does anyone have any questions?